Hello, I'm Dr. Steve Hotze. Welcome to today's program. It's my privilege to have as our guest Dr. Mila McManus. Dr. McManus has a clinic in the Woodlands area, and the name of it is the Woodlands Institute for Health and Wellness. She is trained initially in the American Academy of Bioidentical Hormones. She has her anti-aging degree from A4M, which is the American Academy of Anti-Aging Medicine. She has changed from being a conventionally trained doctor who trained at the University of Texas in Houston, graduated in 2000, top of her class, by the way. She, because of some own personal illnesses, decided to investigate alternative and natural approaches to health. And that's how she ended up being trained in bioidentical hormone therapy and anti-aging therapy and nutritional therapy. She does a great work. And I want you to meet Dr. McManus. So Dr. McManus, thank you for joining us today.
Pleasure to be here and pleasure to see you.
Great to see you. Now, tell us a little bit about your background. Where you're from initially and where you went to undergraduate school. Of course, you went to University of Texas Medical School. And tell us about your journey, how you transitioned from being an allopathic, more conventional oriented physician to a physician that practices natural approaches to health and an integrative practice.
Sure. Well, I'm a native Houstonian, and I basically was sickly from the time I was born until the time I met you when I was 30 years old. So I, had really horrible allergies and IBS problems from infancy, eczema, head to toe. And as I aged, I just developed more issues. In middle school, I had severe acne. And then in high school, I had horrible PMS and periods and mood swings and sleep issues. And then, I got to college and everything else just got worse. And I decided to change my career path from chemical engineering to pre-med at that point. I'm like, okay, fine. I'm just going to go to med school and figure out what the heck is wrong with me and why nobody can fix my problems. Well, that's what I wanted to happen. But what really happened was pretty much what I learned to do in medical school was pile on more pills. I learned a pill for every ill. And by the time I graduated from residency, I was on at least 12 prescription medications, and I had never felt worse in my life. I had never been heavier. I'd never been more tired, depressed. I was miserable day to day. And I saw the same thing. And when I started my family medicine practice, I just realized that I was a drug dealer and I wasn't really getting anybody well. And then I met you and I had the opportunity to learn from you. And it was the most life-changing thing that ever happened for me personally and professionally. So thank you very much.
Well, listen, you have really taken it to a new level, everything you've learned here through bioidentical hormone therapy. So in your practice, so take us, you worked here with me and you trained in bioidentical hormone therapy and natural approaches to health, and opened up your own practice out in the Woodlands. When did you do that?
That was in 2004.
Okay.
I practiced conventional medicine for less than a year out of residency before I jumped ship and never looked back after that. Oh, and I forgot to mention, I did go to UT in Austin for undergraduate,
Right.
and my degree was in psychology at that point. So I loved being in Houston, close to home. I had to come back to go to med school here and did my residency in Houston and then moved back to the Woodlands where I went to high school. And it's been such an amazing journey being able to pay it forward and help people ever since you helped me get well back in 2004.
Well, tell us, how did you get well? What exactly did you do to get yourself well? And, folks, what I have found, most physicians who practice natural approaches to health or integrative practices had health problems themselves that they wanted to try to relieve, and they couldn't get relief in the conventional realm. So they began to question, is there something else? And they began to listen to other physicians who who practiced natural approaches to health, and they began to try and adopt those remedies and recommendations. And then they find out they got well, and they said, my goodness, I've had this and all my patients have got this and I can help them. So tell us your progression. What was it that really made you said you were on 10 or 12 different medications when you got out of med school? How was your transition? What exactly did you do different that changed the way your body healed?
Well, the first thing I learned was that you are what you eat. And that's something we really didn't learn in medical school. And growing up, seeing all sorts of doctors over the years, nobody ever asked me what my diet was like. And, if you live on Cheetos and Ho-Hos and Ding Dongs and Diet Pepsi every day, you're going to pay for it.
You bet.
I grew up on the standard American diet, and that's how I lived up until I learned how to get well. So major dietary changes. I found that I suffered from a lot of food allergies and food sensitivities. Had horrible adrenal dysfunction, which of course affects all your hormones. So supporting my adrenals with bioidentical hormones was also life-changing. Cortisol to this day, I think, is my favorite hormone and just helps you really keep things straight when you live a long hours, high stress job sometimes.
Right.
And so
how about progesterone and female hormones?
yes, well, of course there's a lot of good hormones, but I just feel like cortisol maybe made the biggest impact, and I think it's something that most holistic doctors are afraid of for whatever reason. There's such tiny physiologic doses that can make
Right.
a humongous impact on how you feel and help to balance your other hormones and help with your energy and sleep and stress and pain and allergies and things like that. Help your thyroid work better at the cellular level. So hormones were a big part of my journey of healing, as well as nutrition, as well as addressing my gut health, which was terrible my whole life. And so to be able to have normal bowel function at the age of 30, was just quite amazing. My
What
allergy.
about did you do any thyroid supplementation?
I did. So I was on cortisol and still am, and added thyroid hormone, which I still am on, and progesterone cream, which I am still on. And that's been all I've needed hormonally.
That the key thing is, folks, many individuals, due to poor eating habits, or uh, eventually, as you age, your hormone levels become imbalanced. And these are the hormones that Dr. McManus talks about, your adrenal hormones, and your major adrenal hormone for chronic stress and chronic pain and chronic anxiety and allergies is cortisol. That's your natural occurring steroid. It's an anti-inflammatory. When your body's under chronic strain from allergies or chronic strain from food sensitivities or chemicals in the environment or just stress or poor eating habits, the adrenal gland can become fatigued. And so a little cortisol supports the adrenal gland, and it can be a godsend, particularly in allergy patients. And then progesterone is the balancing hormone in females. It helps balance out the estrogen in their menstrual cycles. And then thyroid, of course, governs your metabolic rate, your metabolism. And so those are three cornerstone hormones that you started taking and you use, I know, in your practice, and we do too here at the Hotze Health Wellness Center. These are key hormones, and they are basically the dose is determined not primarily by your blood work, but it's determined by your clinical improvement and symptoms. So we, like you do, we start on low doses of the various hormones and we increase them until the symptoms are completely resolved. And normally, if we take your blood work for any of the hormones, they're always going to fall within a broad range of normal, because that's how they define what normal is. Wherever 95% of the people fall, they call that normal. So you could have low levels of a hormone in the low range and still be called normal range by your conventional doctor, when in fact, if you increased it and stayed within the normal range, you would have benefits of that particular hormone, whether it's thyroid or progesterone or cortisol. So And you've incorporated these into your practice.
Yes, we use them a lot, and it helps a lot with patients' issues, whether you're 20 something, 30 something, 60 something years old. They really can just help with anti-aging and optimizing your health and well-being. Absolutely, 100%.
We didn't mention testosterone in males as a godsend. I like to say, Mila, that it puts a tiger back in your tank, guys. And by that, I mean it affects your initiative, assertiveness, sense of well-being, your self-confidence, your mood, your goal orientation, your drive, directiveness, decisiveness, analytical ability. These are all brain functions. All the hormones, particularly the sex hormones, have an effect on the way you think. And so male pattern behavior is determined by testosterone. And the things I just mentioned are benefits of having testosterone. And as men age, their testosterone levels inevitably decline. And so men benefit also through hormone supplementation, through testosterone supplementation, which I'm sure you use in your practice as well.
We do. We could spend a whole hour talking about the various forms of testosterone and the pros and cons and why conventional medicine isn't as keen on using testosterone. I remember learning in medical training to give a man a testosterone shot once a month if they had low testosterone. And that's just major injustice for men.
It doesn't work. So anyway, and talk to us now too about your new book. And I've looked through it, haven't read it word for word, but I looked through the table of contents and then I scanned the book. I spent about 30 minutes looking through it, and you have and it's entitled Highway to Health. And it's really a nutritional roadmap. It's basically helping you develop an eating plan. Now, you quote in your book Hippocrates, who was the father of medicine, who said, let food be your medicine and let medicine be your food. And I saw where you had Dr. Hyman saying the most important tool for improving your health is your FARC.
Yes.
Which was an interesting quote. So we know that you can't be any healthier than what you eat, and your foods provide you with nutrition. So let's talk about that. Your philosophy on a healthy eating plan and how people should, once they get their hormones balanced, it doesn't mean you can eat whatever you want to eat. Thyroid governs your metabolism. We commonly see people coming in with low thyroid who are overweight and have a host of health problems, and thyroid helps them feel better, but you can't go on eating like you used to eat. You're supposed to eat to live, not live to eat. So let's talk about your philosophy on a healthy eating plan and what you recommend and what you discourage.
Okay. Well, we discourage eating how I grew up, which is the standard American diet to this day. Everybody is eating horribly ultra processed foods, and it's creating every generation's getting worse and worse health wise, and the toxins in all of our food, the pesticides, herbicides, and all that are on our crops. And we're destroying the planet with toxins and destroying our bodies with toxins. So it's simple. Eat organic, whole foods as much as you can. Eat more plant-based than animal-based. There are a lot of arguments on all sides of how we should eat. Should we be vegan, vegetarian, pescatarian? Should we be carnivores? And let's just start with eating whole foods and organic whenever possible. Every plate for every meal should have a huge pile of fresh, raw produce. That would be a really good way to start all your meals and help balance your blood sugar, help with calories and things. Yeah.
That's really, you bring up that point about raw food, and you're talking about vegetables. When you cook vegetables, that you oftentimes, what happens is you cook out the vitamins and minerals out of them. They don't have the same nutritional value they do as if they're raw. And I myself, of course, salads you're going to eat raw. You're going to eat all your salads are not going to be cooked, obviously, but other foods like broccoli or beans or peas and squash and all those various foods, when you cook them, you lose a lot of the nutritional value. And so I've started eating them raw, and they're delicious. And the other night I had a broccoli on the side for dinner, and I said, I'm not going to cook it. I'm just going to eat it. It was delicious. And you get your nutrition that way. Another thing I want to mention that most people don't think about, it's so important to chew your food to an extreme. Most people take one or two bites and swallow. They take a chomp or two and then swallow. And I've done that in the past. But I read a book or read a story about a physician decades ago who recommended chewing 30 times before you swallow. And when you do that, you really masticate the food and you break it up so it's easily digested and you release the nutrients into your body when you do that. What are your thoughts on that?
Yes, I do that a lot. And sometimes I will check myself because I don't count every single time I'm chewing something, but I will sometimes do a test on myself. Am I getting my 30 chews in? And it's really easy to do when you're mindful about it.
I do the same thing. I'm sitting there 3, 4, 25, 26. And then, but it's amazing because your food really, then you have enzymes in your mouth that helps digest the food and it prepares it for the stomach. And you want to get the most nutritional value out of your food. Also, I read where if you chew that many times, it sends signals to your brain that you're full, that you've done a lot of eating. I don't know how true that is, but I know this. You're down in an ideal body weight because you've eaten, since I first met you 20 some odd years ago, you've really, adopted and got down to an ideal body weight and you look terrific. And part of that, let me ask you this, do you ever do any intermittent fasting?
I do. I absolutely do. And I biohacked that biohack further by adding rapamycin once a week.
Right.
You know,
Tell us about rapamycin.
so the generic name is sirolimus, and I would say the easiest thing I tell patients about rapamycin is that it mimics fasting without having to fast. So I'll do some
Right.
intermittent fasting, and then you take rapamycin once a week and get more benefits out of that. You can get cardiovascular benefits. It can help with things from osteoporosis to help with the fight against cancer and such. Rapamycin was found on Easter Island back in the 1960s when some researchers went over there to look for a new antibiotic, and they found a bacterial strain that produced a substance that they felt was antibiotic. So they brought it back to do some research, and while it did have those properties, they found that it was suppressing the immune system. So what they decided instead was, well, let's use it as an immunosuppressant. So to this day, it's used to help prevent organ rejection in transplant patients. But it's used at higher doses, daily doses, which is very different from using it repurposed as a low intermittent dose, such as I said, taking once a week has vastly different benefits.
Right. And what it does is it stimulates autophagy, and that's the cleanup of your cells. Your cells are constantly working and have a lot of byproducts, and that's just junk and garbage in your cells, and they've got to be cleaned out. Unfortunately, most people, because they eat so much and eat all the time, their cells never get a chance to go through the cleaning process. And this stimulates the cleaning process called autophagy, and that's what intermittent fasting does. I'm glad to hear you do intermittent fasting. I've done intermittent fasting most of my life. There was a time when I used to have lunch, but I don't eat breakfast and I don't eat lunch, and I have a small portion for dinner. And I weigh 160 pounds. I'm 6 foot tall. I'm 4 pounds under my playing weight in high school. And that is, and it's the old adage, skinny people live longer than fat people. That's just a statistic. That's just an insurance statistic. So we always try to encourage our guests, and we call our patients guests, we try to encourage, get down to an ideal body weight, get down to your ideal body weight. That's so critical for your long-term health, because when you carry around extra weight, it's going to have a host of health problems. It can lead to adult onset diabetes, lead to cardiovascular problems. It can lead to joint problems. Gee, uh, the amount of people that are going through joint replacement surgery is remarkable. And we even see that among our guests. And they have this, they've come in and they're overweight, their joints are giving out, and they've had knee replacements or hip replacements. Folks, if you'll get down to an ideal body weight, you're not going to put all that stress on your joints. And that's very critical and important to do. So intermittent fasting is a way to do that. And even a 24-hour, 48 or 72-hour fast can be very helpful for you. And most people are not trained to do that or think that way. We've become so addicted to our foods because they're high in sugar content and plus all the chemicals they put in it to make us want to eat the food. Talk to us about your thoughts on Robert Kennedy and his position as the head of the Health and Human Services.
Yay, make America healthy again, please. I just think it's fantastic the direction things are headed with, cleaning up the food supply. I think it's probably going to take a while, and we'll see if there's going to be any repercussions from the food industry about it, make food prices even higher because they have to use natural substances over chemicals, and of course food prices are already high. So I'm starting to get into, slowly but surely, baby steps, progress over perfection, is what can I grow myself?
There you go.
How can I save money? How can I ensure that the food I'm eating is clean? And last year I joined the board of directors for a nonprofit called the Organic Horticulture Benefits Alliance, which teaches people organic farming. It's amazing.
I need you to send me information about that. We have a place out in the country, and we have a large garden, several acres, that I have my foreman grow, and we grow all our products naturally out there. But I'd like to hear about this organization because I'd like to get him in touch with him to make sure we're doing everything correctly in growing our food products. But I would encourage you folks, start growing your own food. You can grow a tremendous amount of food in a very small space in your backyard, or if you have a solarium and a solarium, you'd be amazing. Everything from tomatoes to squash to beans to jalapeno peppers, all of these cucumbers. It's amazing what you can grow and how good they taste when they're homegrown. My goodness, night and day difference between store-bought. Even when you buy organic store-bought, they're so much better. So I'd encourage you to do that. Now, look, let's talk about two other things. And
Okay.
one that's about water. Tell us about the importance of water and how do we prevent ourselves from being exposed to chemicals like fluoride, chlorine, and all the other chemicals that are in our water that come out of the tap.
Yeah, again, I would say progress over perfection. It's water filters can get quite expensive. So start saving now. If you're on a tight budget, start saving up for it now because clean water is paramount to good health. Tap water can be kind of scary with what you find in it. And if, you can even call your local water districts and ask them what's in it and do you have chloramines in it and things like that. And you can even smell that coming out of the tap. And so, we put a whole home filter on our house several years ago. And then we added reverse osmosis at
Right.
the kitchen sink with the addition, it adds back minerals to that water. Because when they first came out with reverse osmosis filters, they realized there was problems with that because people were getting depleted in minerals naturally found in water. So I'm a big fan of reverse osmosis as long as the minerals are being added back. And there are a lot of filters, but there are a lot of filters that you can get that you can put in the fridge, but they seem to be all plastic, and that's a huge concern. So I would say the first thing you can do as an investment in your health is quit drinking out of plastic water bottles.
Yes.
Yes, they're convenient. Do I ever drink out of a plastic water bottle? Yes, but I avoid it as much as possible. And on my desk, I have a glass and I have a glass pitcher that I use to refill my glass of water throughout the day. Cheers to you, Dr. Hotze.
To you too.
And hydration is important for energy, for cognition, for your metabolism, for flushing out toxins. So please drink plenty of water and make sure it's clean.
I think the most important thing you need to do with your water is to filter out fluoride. Fluoride is put in the municipal water in 70 to 75% of all the municipal water in the country. It started back in the 1950s, and it was sold by the chemical industry and particularly the food fertilizer industry that had these byproducts of fluoride. And what they had to do is find a way to get rid of it. So they decided they were going to sell it as a tooth decay preventative, because they said, we found some cases in the country where people have fluoride in their water naturally, and they have lower cavities. So there was a big fight going on, and you're not old enough to remember it. I remember watching it on TV City Hall meetings when people were complaining about them putting fluoride in the water. And we now know that fluoride has an adverse effect on your thyroid function. You have an enzyme within every cell of your body that converts the inactive thyroid hormone T4 with 4 iodine molecules on it to T3. That's the active T3. Thyroid with 3 iodine molecules is the active thyroid hormone. When you take fluoride and have fluoride in your water, it poisons the deiodinase enzyme, so it doesn't convert T4 to T3. You could have perfectly normal levels of T4 in your blood, and they say your blood levels are normal, but you've got fluoride you're drinking, and it's poisoning your deiodinase enzyme. It also can compete with iodine, which is part of the thyroid molecule, and you can make thyroid, it affects the gland because it's a halogen, just like iodine. If you remember your periodic table in high school that you memorized or learned, there's halogens, and that's chlorine and bromide and fluoride and several others. But it competes with iodine, so it adversely affects thyroid creation of thyroid hormones within the gland. So that's very important to make sure you filter out fluoride in your water. Are you familiar at all with Kangen water? Kangen. Have you heard of that?
I am familiar with it, but it's been a minute since I looked at that.
Yeah. Anyway, that's something we also use at our home. We have a Kangen machine that what it does is it alkalinizes the water. And I'm not quite sure how it does it through electrolysis, but it converts water from being neutral at 7.4, even some local water is a little acidic under 7.4. And that's a measurement from 0 to 14 is a measurement of the acidity or alkalinity in water or of any product. And when the Kangen, you end up getting alkaline water. And alkaline water can be very helpful in the treatment of cancer, as a matter of fact, because cancer thrives on acidic environments, and this helps convert to a more alkaline environment in your blood. So we use that at our home and have been, as well as reverse osmosis. But as you say, it's important with reverse osmosis that you put back the vitamins or the minerals that are taken out of the water. So the other thing, and you were talking about and you mentioned briefly about plastics. Let's talk a little bit about plastic and the danger of plastics in our environment. And they're ubiquitous. I hate going out. I go out and I bring home some food. It's all in plastics. It's in styrofoam. It's in plastic bags. I go to the grocery store. It's plastic. When I go to the grocery store, I always say, could you please put it in paper for me? Because I hate to think that plastic, I'm going to take something out, I'm going to throw plastic in the trash can, and that's going to poison the environment. Think of I think you mentioned that there were 350 million tons of plastic produced in 2015. 2 million 50 years ago, 2 million tons. Now it's 350 50 million tons every year of plastic, and that gets in the environment, gets in the ocean. And how does that affect our health? It
Yeah.
can't be good for you.
No. Well, while I think about it, I wanted to say, people say, oh, well, it says it's BPA free. And I'm like, okay, that might be true, but you guaranteed it's got BP something else in it. Right?
Sure, it's plastic. In plastic are petrochemicals, and petrochemicals are toxic. That's just the long and the short of it. So
Yeah.
if you're going to, that's why we recommend getting a reverse osmosis so you have clean water, or get yourself Mountain Valley water. Drink out of, you can buy that through a Mountain Valley dealer. I had a chance to buy that about 25 or 30 years ago. I had one of our guests owned the company here in town, the distributorship, but I didn't buy it. I wish I had. I think I could have retired, because people are getting more and more trained to get away from water and plastic. You can get water and plastic that you have at the office or even at your home in big plastic barrels, but Mountain Valley water has it in glass, both small glasses, and they also can have glass at home. And we've used that before we had our reverse osmosis. We used Mountain Valley water. It's delicious. It comes out of Arkansas, out of some spring there, and it's great.
Yeah, sure.
So you want to stay away from plastic. Interestingly, we don't do routinely now, but we have done testing for organic chemicals in the blood. And I did this test, I don't know, 10 or 15, 20 years ago, tested my blood to see if I had any organic solvents in it. And what came out in the 95 percentile was styrofoam, of all things. Well, you think about when we were doing our residencies and doing our training in medical school, you'd have to stay up all night, and you'd always drink coffee out of a styrofoam cup, right? That's all they had. And it was hot coffee. And of course, the styrofoam gets in the system. I hadn't used styrofoam for decades after I got out of medical school, because I said, that just can't be good for you. But when I go play golf, I drink out of a styrofoam glass and put ice in it, but I justified it and said, well, it's not hot, so the styrofoam is not going to get into the water. I checked my blood. I'm in the 95 percentile for styrofoam, and I don't know if there's any way to get styrofoam out of your body.
That's a good question. I do see it a lot when we test for environmental toxicants as well. And, because you mentioned plastic, I would just say in general with all toxins, they are ubiquitous. We've all got lots of them, but we don't all detoxify at the same rate, clear those toxins. And some of us are exposed to more toxins than others. And, toxins in general can cause problems with your nervous system. They can cause cancer. They can affect your hormone balance, and especially the xenoestrogens that act like estrogen in the body. And it's always good to be supporting your detox pathways and being more mindful about your exposure to toxins. So use cleaner personal care products, and try to get things in glasses instead of plastic containers whenever possible. It drives me nuts that we buy organic hummus or organic something like that, but it all comes in plastic containers.
Isn't that the truth? Well, listen, you made a key point about xenoestrogens. Folks, xenoestrogens are chemicals that mimic estrogen. Those are the petrochemical products. That's what you get out of when you drink out of plastic bottles or anything that's cooked in plastic. Anytime you get plastic in your system, it's a xenoestrogen, and it adversely affects your body's natural sex hormone production, both in males and females. So it's very important for you to eliminate. Look, we see guys coming in nowadays with testosterone levels when they're in their 20s and 30s that look like they're there in their 60s or 70s, because they've been exposed to all these various chemicals and the petrochemicals, and the chemicals have turned down their testosterone production. And that is very critical. I think that's one of the reasons we see so many soy boys walking around these days. You know what I'm talking about.
I do.
We don't see John Wayne's, we see all these soy boys. And I think that's one of the big problems that we've got, is because when you have low testosterone level in males, then all the masculine male characteristics decline. They don't have it. In fact, they become effeminate. So the poisoning of our environment has an adverse effect on people's health and upon their development and upon their mental status and how they live out their lives. We highly recommend do whatever you can to eliminate plastic. Please never cook in plastic, and don't put plastic in a microwave, for crying out loud, in a bucket. You're just going to poison yourself. Tell us, what do you recommend on detox of poisons of these various chemicals? What does your detox program look like?
Well, it depends on what the toxins are. So there's toxins like mold toxins, and then there's the toxic,
Right.
which are all the artificial ones, right? And so we typically recommend a blend of binders, and you can find capsules that have zeolite and charcoal and humates and folate and all together in one that can help. Even certain probiotics can help, like Aspulardi, for instance, can help with some types of chemicals. Glutathione, which is the body's master antioxidant and liver detoxifier. Also, we recommend reducing exposure first is the best thing that you can do. Also infrared saunas. And also I explain a lot to patients about there's detoxing and then there's drainage. And the drainage is your elimination pathways. And those need to be working well for you to really be able to detoxify. And if your elimination pathways aren't good, then you're just going to keep recycling these toxins within you and just feel terrible. So I always tell my patients, you need to be having good regular bowel movements. You need to be hydrating really well so that you can sweat out and urinate toxins out. You need to sweat with exercise, infrared saunas. You can sweat out toxins as well. And you need to make sure that your lymphatic system is moving with also exercise, vibration therapy, vibration plates. There's a million of them on Amazon you can get for $100 or so. We recommend those. And just movement is critical. So get moving.
Now, I know you treat for cancer as well, some alternative approaches to cancer. Tell us about that and what you do in trying to help people either prevent, control, or eliminate their cancer. What products do you use and what do you recommend on that? Obviously, eating is going to be a very big, important part of that plan. So you might explain that and whatever other products you recommend.
Yeah, I've had a personal interest in natural cancer therapies for so long, from when my brother-in-law died pretty quickly when I was 18 years old of testicular cancer, and I didn't really understand it. And then I had another close family member who was diagnosed with breast cancer when I was going through medical school. And I still was like, can't you just cut it out? I'm trying to understand this better. And then, it's just, I've been touched by it so much over the years, and cancer is just becoming more and more rampant.
It's crazy.
It is crazy. It's exploding. It's terrible. So we are here to support people however they want to do their cancer journey. So we have patients who come in and they're brand new to their diagnosis and they haven't decided. They're leaning towards, I don't want to do anything conventional, to I'm scared not to do anything conventional. And I'm like, I can't make that decision for you. We are here to help you. I can provide you information. You should explore all avenues before you make that decision. And we have patients who are undergoing the conventional therapies, chemos and surgeries and things like that. And so we want to help mitigate the side effects of that. And we use IV therapies. We have an energy medicine device called OnDemed. That's quite amazing. We use, just nutrients, a lot of different supplements that can help with the cancer fight, like curcumin and quercetin and selenium, and supplement called poly-MBA, which is basically a really potent form of lipoic acid, which can be helpful. And we have a lot of modalities too that can be very helpful as complementary and synergistic therapies with conventional medicine. But back to the nutritional part, there's been a lot of debate over the years of, okay, when somebody has cancer and you're trying to reverse it or just get through chemo, how do I eat? What's the best way to eat? Well, they've found that fasting right before chemo can actually help a lot with the side effects. But in terms of how to eat, we've been morphing over the years towards more plant-based in general,
Right.
General nutrition guidelines. But the raw organic vegan diet sounds pretty critical when you're trying to reverse cancer.
Right. Cancer grows on sugar too. So we encourage our guests that have cancer to eliminate as much as they possibly can sugar in the diet and to eat a more ketogenic based program, because cancer can't live on fat. It can convert glycine into sugar, and that's why some of the treatments like Dr. Brzezinski, when he has his anti-neoplastins, that blocks glycine, the production of glycine in the body, and he's had some tremendous results on his cancer therapy. We've been very pleased with people that have gone there, have done very well at Brzezinski. Dr. Stanislaus Brzezinski, who's been a leader in cancer therapy for 45 years, and he's fought the medical establishment every inch of the way. I admire him, and I've seen some absolutely incredible successes that he's had. What about the use of antiparasitics, ivermectin, mebendazole? People know it as fenbendazole, which is the animal analog of the human medication, mebendazole. They're basically sister drugs. Both do the same thing. They're antiparasitics. What has your experience been in using these particular repurposed drugs for the treatment of cancer?
Yes, we do use a number of repurposed pharmaceuticals to help with the fight against cancer. And I've found that they're very well tolerated, and a really critical part of helping to reverse cancer and preventing it from coming back is to address all the root causes. And one of my, when I tell people of all of the symptoms and diseases that are out there, thousands of them, that people suffer with, the root causes kind of boil down to about 10 things. And that list of 10 things, is nutrition. It is addressing gut health and balancing hormones and getting and detoxing, but also dealing with microbes. I like to say that we all just need a little critter control every once in a while. Our bodies are riddled with parasites and viruses and bacteria. And, if you've got a really good immune system, you can keep them at bay. But once you have cancer and your immune system is suffering, these things can really run amok and get the upper hand. So clearing out microbes in general, from yeast and molds and bacteria that don't need to be there, and getting viruses under control and getting rid of parasites are all critical for, I think, everybody in optimizing their health anyway.
One other thing I'd like to bring up is dental hygiene. Now, Mila, I took out my mercury amalgams 20 years ago. My wife did too, because I just said mercury can be good. I'd read stuff about how can mercury in your body be good for you, and it's not. It's a toxin. It's a poison. So we had them removed. And then, as I mentioned to you, I have written a new book called Health Span, which will be coming out probably in the fall, once it goes through the whole publishing process. And in doing that, I did a chapter on dental health and oral hygiene. And I did a deep dive on that. And I had Dr. Blanche Gruby on my show several times. I read Hal Huggins, and I had heard numerous conferences at various conferences over the year. I'd heard physicians talking about dental health, particularly about the dangers of root canals. So I did a deep dive on that, and I came to the conclusion that all good health starts right with your mouth. And as a physician, I was never trained on anything about oral hygiene at all. I just wasn't. Frankly, in anatomy class, I can't even remember they made us memorize the teeth. So we didn't we learned nothing, at least in medical school. I learned nothing about the relation between dental health and oral health. And chronic disease. Likewise, dentists don't understand chronic diseases and the effect of the health of the mouth on chronic diseases. They're worried about making sure you have good looking teeth. So both professions don't understand the connection. I mean, in reading, I did some reading and saw some studies from cardiologist papers recently in the last 3 or 4 years that found that the very microbes, the bacteria, gram-negative bacteria found in root canals and in the periodontal disease were found in the plaques of the coronary arteries. Now, they said, we don't know if it has any relation, but we know that coronary artery disease is caused by inflammation, not by cholesterol. Cholesterol is the patch that covers the deteriorating artery that's inflamed. Something is causing that inflammation. And if you find gram-negative bacteria, and these are anaerobic bacteria that don't need oxygen, you find the same bugs from your teeth in your heart plaques, there's got to be a relation. It's kind of like if you walk in the house and there's a burglar there with a gun, you go, well, I don't really know why he's here. Well, of course you know why he's here. He's got a gun. He's robbing your house. And so if you've got microorganisms, bacteria on your coronary arteries, you know they're causing inflammation because that's what they do. So we look now at and ask about root canals. We ask about cavitations, periodontal disease, and we look at that, and we recommend when people have various problems in mercury amalgams, we recommend they see a biological dentist, not a regular dentist, a biological dentist who's trained in the treatment of natural treatments of oral health problems. And I've been very pleased. We use Dr. Toe out here, Katie Toe, T-O. She's out in Katy, and she runs a great operation. I highly recommend. I went and saw her. I'd never had as an extensive dental evaluation. The first examination, I was there for 3 hours. The whole time they were studying my teeth. It was incredible. So we recommend seeing a biological dentist, particularly if you have root canals. Root canals are always going to have bacteria. You've got 3 million, you have 3 miles of microtubules in every tooth, 3 miles. So they're so thin, you can't get to the bacteria. They go, well, we took out the nerve root and we squirted some antiseptic up there. You can't get an infection. Well, Dr. Huggins proved that you can. Everybody that has a root canal, you pull that tooth out, that tooth has got bacteria in it. Those bacteria seed their toxin and the bacteria into the bloodstream, and they can cause a host of chronic diseases. So that's something else I've just begun to really focus on with all our guests. So we always ask about their dental health. Now think about this. You go to a cardiologist and you've had a history of maybe heart disease, and you've got atherosclerosis, or you've had a heart attack, or you've had chest pain. How many have ever had the cardiologist sit down and say, let's talk about your oral hygiene? Have you had a root canal? Have you had your molars pulled, your wisdom teeth? Do you have any periodontal disease? Do you have any mercury? Let's take a look. Normally, if they even look in your mouth, they just open it up like I've always done, stick a blade down there and say, good, look at the tonsils, and don't really take a real good look at the mouth. But here's a story. Every farmer and every rancher, when they go to buy livestock, guess what the first thing they do?
Look in the mouth. Look
in the mouth. If they have poor dental hygiene, they will not buy the animal. They know that. So we've started here among myself and our other providers to say, we're going to act like farmers. We're going to start looking and taking an interest in the oral hygiene of our patients, to see if the root cause of some of their symptoms and problems, whether it's neurological disorders. I mean, think about mercury adversely affects your nerves. It adversely affects the myelin sheaths. And so people that have maybe cerebral palsy, or they've got neurological disorders that may all be coming from the mercury within their mouth. So we've taken a new interest in that, and time will tell how much difference it makes, but we believe it's going to make a big difference in the health of our guests. I thought I'd share that with you, and I don't know whether you've started taking interest in that yet or not, but if you haven't, I encourage you to, and I'll send you some information about it.
Oh, thank you. Yes, we do. For years, we have recommended biological dentists.
Good for you.
Get them root canals dealt with, especially. I learned so many years ago when I was first learning about PEMF therapies. And it was really interesting what the speaker said. And he said that a root canal is like a circuit breaker. If you think about the meridians that acupuncture work on, and that go through the teeth, and that, like a surgical scar is another type of circuit breaker, but a root canal is a circuit breaker. And so everything in that meridian can't keep up its voltage, and it just starts to get lower and lower and lower. And as the voltage in your cells along that meridian, as the voltage lowers, the oxygen levels lower, the cells become dysfunctional. And when that oxygen gets super low is where cancer starts. And that was just something profound that I learned so many years ago. And that's when I started recommending biologic dentists.
Well, so you're way ahead of the game, and it's amazing how your practice and our practices have just tracked each other. That's so it's so wonderful to have a physician like Dr. Mila McManus in the greater Houston area. She is a tremendous physician. She's in the Woodlands area. And how can our listeners or viewers find you on the internet? What's your website?
Oh, well, thank you. Our name is the Woodlands Institute for Health and Wellness. So you can Google that. You can Google my name and find our website. So in short, it's twihw.com.
Thank each one of you for joining us today. I'm Dr. Hotze. Have a great day.